So we don't know at this point the number of foreign nationals using health facilities in South Africa. But what does the law say about foreigners accessing medical care in the country?
Good afternoon, and thank you very much for asking us, Pembina. So yes, there are different national laws and policies in South Africa, clearly stating who has able to access healthcare and who must pay for the services. And the first one is the Constitution of South Africa, where the right, where it's set out that all people, regardless of their nationality or legal status, um, have access or should have access to healthcare services, and no one may be refused emergency medical treatment. Then we have our National Health Act also confirming that all persons in South Africa can access primary healthcare at clinics and community centers. And again, all pregnant or breastfeeding women and children under the age of 6 are entitled to healthcare at any level. And then we have the Refugees Act of South Africa, and it sets out the rights for asylum seekers and refugees in South Africa. And again, that the refugees in South Africa has the same right to access healthcare as South African citizens. And then we have a very interesting Department of Health 2007 circular, also confirming refugees and asylum seekers with or without permits can access the same basic health services, and also having access to antiretroviral treatment in cases of HIV. However, does not mean all of these services are free, but that's it. That's very important to understand, that there are policies and laws governing healthcare access in South Africa, and definitely not a vigilante group.
Right. So there is increasing concern in South Africa about the impact of undocumented immigrants on the country's health system. How serious is the problem in the country?
So this is also a very important question, and there are no official data on healthcare in South Africa used by migrants, legal immigrants, and South Africans not being able to pay. The system or the stats cannot distinguish. So it's all anecdotal. Yes, we do understand that there are a lot of people making use of our healthcare systems, depending on what province is the closest to the border of that said other country. But again, we lack the data. And if we don't have the proper data, then we cannot measure it, we cannot define it, and it becomes extremely difficult to say it is illegal immigrants at this stage putting a burden on our healthcare system. Our healthcare system has got a lot of problems, but not solely due to, unfortunately, migrants.
I mean, you preempted my next question, because I was going to ask you, Dr. Coetzee, from the perspective of an outsider looking in South Africa, there is clearly an issue. The problem, though, is, help us understand, is it an issue of foreigners straining the healthcare system, or is the system itself failing?
To answer your question, without proper stats at this stage of illegal immigrants or migrants making use of the system, knowing the system, our current system, I would say it's more a failure of this healthcare system in South Africa. There's a huge collapse in some of the services, especially in the public sector, and that's due to a lot of other problems, of which corruption, HR problems, people employed in jobs that should not be there, money is not spent correctly. I think that's a huge issue, and that would, if you really have stats, I think it would show that the bulk of our problems is rather lying with poor management than migrants or illegal immigrants putting a strain on our healthcare system. And I'm not going to say there's not problems. Yes, there are problems. Some of them do come here to deliver, get their babies. But then again, that is in line with what our constitution and some of the laws are saying in our country and policies. So it makes it difficult to blame the illegal immigrant making use of our healthcare system.
All right.
And it's lying on a different level.